The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, and I'm here with a new edition of the Genuine Article where I discuss some of the interesting reports or considerations that are going on with the journal at the current time. And the topic I'd like to address now is obesity in the heart. Now, clearly, obesity in our society is a very prominent topic. It's difficult to pick up a news magazine or a newspaper where there isn't some article about the increasing obesity of our population and the various diseases, cardiovascular and otherwise, that the obesity contributes to. Interestingly enough, while all this is going on in the lay press, in the journal, we're seeing more and more articles submitted on the obesity paradox. While it seems to be clear that obesity in otherwise healthy individuals has an adverse cardiovascular effect, this isn't true necessarily of all organ systems. And in addition to that, an increased body mass index, increased weight or obesity, if you will, seems to have some protective effects in advanced cardiac disease, such as heart failure. So it's not a straightforward topic in the medical literature, but we have two manuscripts coming out in a forthcoming issue of JACC that really address the issue of obesity. One manuscript is published by Dr. Madala and Associates and deals with the issue of the relationship between obesity and the age of an individual when they have a first myocardial infarction. And because obesity, particularly abdominal obesity, can produce adipokines and other inflammatory agents, it's reasonable to think that obesity may in fact predispose to acute myocardial infarction. And one way to measure this would be to look at the age at which a first myocardial infarction occurred. And so these authors went to the Crusade Registry. So this is a voluntary registry which has all the limitations of an administrative database, but has all the advantages, which include huge numbers. In fact, they were ultimately analyzing 118,000 patients who presented with their initial non-ST segment elevation myocardial infarction. And they gleaned these patients from about 2001 to 2007. What they found was fairly striking. For the leanest patients, the first acute MI occurred at age 74, whereas for the heaviest patients assessed by body mass index, in fact, the highest, the first myocardial infarction occurred at age 59. So just looking at this, if you're in the thinnest cohort of patients, you're probably going to decrease the onset of your first myocardial infarction by about 15 years. Now, looking at another aspect, Dr. Hammer and Associates in Europe examined the question of whether myocardial triglyceride content in diabetics could be decreased markedly by very stringent caloric restriction. Now, this was a different kind of study. They didn't have 112,000 patients. In fact, they had 12. But these were 12 very, very carefully studied patients, and they used magnetic resonance spectroscopy, a powerful tool, to be able to measure myocardial triglyceride content. And not surprisingly, in these 12 diabetic patients at baseline, myocardial triglyceride content was increased. So these hearts of these obese individuals with diabetes actually had accumulated an increased amount of triglycerides. They were then subjected to 16 weeks of a very stringent caloric restricted diet, and sure enough, myocardial triglyceride content diminished. In fact, it went from about 0.88 down to about 0.64, or roughly a 27% reduction in myocardial triglyceride content in these obese diabetic patients. And in fact, their body mass index measured 35 at baseline. The caloric restriction was fairly profound but very effective, and body mass index in this group of 12 patients was decreased from 35 to 27 over the 16-week period of study. Does this have an effect on cardiac function? Well, in fact, they found some evidence that as these triglycerides were removed from the myocardium, that diastolic function improved. So in aggregate, what can we say from these two studies? Interesting studies in the literature. One using a huge registry of patients, none of whom were actually seen, but in whom the statistics are powerful, showing the adverse effects of obesity on age of infarction. The other one providing us with some very hopeful evidence that, in fact, by caloric restriction, we can reverse some of the adverse effects of obesity, at least in diabetics. I think, for me, the answer is clear. I will prefer to stay as thin as my voracious appetite will enable me to stay. For the Genuine article, this is Tony DeMaria.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.